Hello, Nursing265. This is Frances Carvalho, your instructor, and we are going to do a short video segment on brain abscess. This corresponds to your Neuro Part 2 PowerPoint slides 24 through 27. I'll be glancing over at my laptop just to make sure that I'm following along appropriately. And remember, as you go through and create your concept maps, make sure you have risk, who's at risk, of course the pathophysiology, signs and symptoms of the disease process, the diagnostics involved, the treatment involved, as well as the nursing interventions and education that is needed for nursing care, and also for education for the patient and the family. All right, so brain abscess. It's a purulent infection. It can be a complication of meningitis. And basically, if you look at your slide in slide number 24 in your PowerPoint, you'll see this round encapsulated pus pocket, if you will. It can be caused by different organisms, and their route of entry can include your sinuses, your eyes, your ears, as well as ingestion from like trichomonas, something like that. It can also be caused by septic emboli. We know about infective endocarditis and the embolic showers that can occur. And if they go up to your brain from your heart valve, then of course it can also seed there as well. Lungs can do it too, septic emboli from the lungs, especially PEs. And then dental and periodontal abscesses, as you can well imagine, that is very close to your brain. So we always get our teeth treated. That is why we do root canals, etc. So your clinical manifestations, headache, fever, lethargy, neurological defects, seizures. These should all sound strangely familiar, as we have talked about already about meningitis and encephalitis. Cerebral edema can increase your ICP, so then you're going to get nausea and vomiting as well. Early, your pupil response is normal, and that can be tricky. That's why nursing interventions include frequent neuro checks to make sure that you can pinpoint when those things have changed. Late, you'll have sluggish pupils, and that is due to the increased ICP that's occurring inside your brain. Again, those abscesses can take up valuable real estate space. There's only so much room in this little noggin, and it should be dedicated to your brain, CSF fluid, and blood. Diagnostics include labs. You may see an elevation in their white count, ESR as well. You're going to do cultures, both of the nares, the mucous membranes, blood, and urine as well. MRI, CT, MRI if indicated, and EEG as well. They might do a lumbar puncture just to make sure it's not meningitis. And then as well, the other thing that you might see here is for diagnostics is just even a chest, an x-ray of the head as well. There's a couple of management ideas out there. First is if it's large enough, they're gonna, and it's taking up too much space, creating too much ICP, then they're going to do a burr hole, they're going to do a craniotomy, they're going to make sure to decompress that space and possibly just empty out the abscess itself, physically evacuate it. Not without risk, I'm sure, as you can well imagine. Non-surgical treatment includes lots of antibiotics. We're talking big guns: penicillin G, nafacillin, vancomycin, flagyl. Of course, you're also going to have analgesics. You may or may not have steroids, depending on what the ICP and the inflammation is going on in there. You're certainly going to be on anti-seizure medicines as well, like Dilantin, or phenytoin is the other name for it. Your nursing care includes, of course, patient management. If they lose their airway, you're going to have them on a ventilator. They may need to be sedated. They also will need to be on seizure precautions. Depending on the organism, they may need to be on contact precautions as well, or droplet, depending on the organism and what is the complication of. Certainly, you're going to have some sort of multiple IVs, urinary catheters as well, and just excellent nursing care. These people really need your very, very best. Neuroassessments, I can't emphasize how important that is. And just complications of immobility. They're not going to be moving a whole lot, so we'll need to turn them. We'll need to make sure their range of motion happens. We'll need to make sure that their pain is managed, their fevers are managed, etc. That concludes our abscess. I do want to mention that I had a friend of mine that I used to work with at Christus Santa Rosa. I saw her at Maine Methodist, and I was like surprised to see her there. And I was there with the clinical group. And she told me that her nephew had gotten trichomonas from undercooked pork. And if you will, please Google image trichomonas of the brain and look and see. You can see it almost looks like little pock marks that are in the brain. And what happened with him is he had these worms. They were giving him medicines to kill the worms. But every time that they died, they, of course, kind of ruptured, and then it would encapsulate into a small abscess. And so he had numerous of these. And every time one ruptured, which was considered a positive medical advancement because now he had less worms in his brain, but every time it ruptured, he would have a seizure and he had an abscess. So then they would have to treat that. So it was slow going. He actually did finally recover, and all of the abscesses were gone. All the worms were gone, and I was there actually one Monday night for when he came around and thanked his nurses. He did have his speech affected, etc., but he did walk onto that unit and thank his nurses, and that was pretty special. He was 17. Those little guys, they recover. That concludes Abscess.